When we talk about structural deficits in healthcare in the GCC area, we talk about deficit in a knowledge industry. This industry is quite challenging, and the delivery part of it does not come overnight. It needs heavily regulated institutions. It needs qualified staff. So this takes time. Now, if I speak of my own personal experience, out of Jeddah, we were the last hospital that went on stream in 1985. And the last one has just been opened 2 years ago. So imagine in a city like Jeddah, I'm talking private sector specifically, it took more than 25 years to start a private hospital of a certain size. Now imagine how much the population of Jeddah has grown up at that time, since then. And that is a very challenging subject. And the difficulty about healthcare is that not many people wants to do that or to invest in this field because it is a knowledge industry. If you look around, most of the hospitals in the private sector have been owned or started by a doctor in a family. So this is what makes it difficult, and that's why I am a believer that there will always be a gap between supply and demand in healthcare services particularly. And the government of Saudi Arabia has realized that among the GCC countries, they have provided soft loans for since 30 years to the private sector. This is very unique. This was created, this was the reason an organization like us was created, by these long-term interest-free loans to the private sector. Compulsory insurance has done a huge impact on us in Saudi Arabia. I'll give you an example. Imagine when you have an industry that was worth something like $2 billion before health insurance. And then when you have 8 million expats times $1,000 on average, then you have $8 billion worth of premium. That's quadrupling the load. Imagine the work on your desk is quadrupled overnight. So there's going to be, and there is already, a lot of rush in Saudi Arabia on the private sector for healthcare services. Now, there are many obstacles. There's a lot of supply, right? A lot of demand. Now we talk about supply. Try to build a hospital now in Saudi and see how much money you will need to buy land to start with, to buy land that is in the vicinity of a city, and to go through the regulations of approval of a hospital, while buying and selling land could bring you, bare land, could bring you profits up to 50% a year. Why would somebody go into healthcare industry for a margin of 5 to 10%, while he can make, with the headache involved and with the regulations involved, while he can make 50% a year buying and selling bare land, doing nothing? So that increases the gap between supply and demand also. There are not many people who want to do healthcare, for your information. It's a hell of an industry. It's a very difficult industry. And the public is very sensitive about it, particularly the private sector. While you even compete against government who gives the service for free. Imagine you have a bottling plant where you sell a bottle for 1 real and the government has another a bottling plant next door and they give bottles for free. That is the challenge. Medical education is a real problem. At least 40 years. He will have to go through medical education, and there are countries that require even to have a bachelor degree before you go into medicine. And then you need to have, if you want to go to the higher degrees. My brother, Dr. Batterjee, took 13 years to become a good doctor after high school. So it takes between 35 to 40 years to make a good doctor. And then while we are the population growth of one of the highest in the world, and so the gap is getting wider and wider, and even universities are not being built to that speed. Most of the governments in the Arab world have not addressed this subspecialty particularly. The role of the private sector in healthcare services is not to be undermined at all. The Saudi government has proven that with their support to the private sector over the past 30 years or more, they have created many organizations with reasonable quality by giving them soft loans. In the private sector in Saudi Arabia, there are about 150 hospitals, and in the government there is about 250 hospitals. Now, of course, not the same size if you compare hospital to hospital, but yet still, in Jeddah, for example, there are 35 private hospitals in Jeddah city alone, while there are 8 hospitals from the government side. So in Jeddah, I can proudly say that the private sector is working hand in hand with the government to relieve a lot of pressure from the government. Now remember that the government of Saudi Arabia is giving free medical care, and that creates pressure on them, while private sector is charging for it. And had it not been for the private sector now, the medical scheme for expats in Saudi Arabia would have collapsed. But the private sector is taking that load, which came suddenly over 2 years. There were not many private hospitals came on stream during that period where the compulsory healthcare scheme was applied. So yet still there was ample capacity in the private sector to take that load. And I believe that the private sector will realize the potential in this area. It will take long, because mainly because of price of land in Saudi, in the vicinity of the city. But other than that, I believe that the private sector role is the future for all GCC and for all Arab countries, and they have to address it, and they have to follow the Saudi experience in this.